Hello everyone and welcome to my channel. Today's video is about the cardiovascular system. The cardiovascular system is composed of the heart, blood vessels, and the lymphatics. The blood vessels, the red ones are arteries. They're red because they carry oxygen, except the pulmonary artery. The blue ones are veins. They carry deoxygenated blood with no oxygen, except the pulmonary veins. Blood vessels are part of the cardiovascular system. They transport blood around the body to tissues and organs, the red and the blue. Arteries carry oxygenated blood away from the heart to tissues and organs. Veins, the blue ones, collect the oxygenated blood from tissues and organs and bring it back to the heart. Capillaries are the smallest blood vessels. They connect the arteries to the veins, and substances are exchanged between blood and tissues at the capillaries. The lymphatic circulation works with the cardiovascular system. It drains and filters the tissue fluid and brings it back to the circulating blood. The role of the cardiovascular system is to deliver oxygen, nutrients, hormones, and other important substances to tissues and organs in our body. It also helps to remove waste, and it does regulate the blood flow and the blood pressure, and it also helps to maintain our body temperature. Our cardiovascular system is so important. It is the first system to start functioning after conception. A heartbeat starts at about 5 weeks of pregnancy. Let's use a model to look at where the heart is located. So the heart sits centrally in the middle, slightly to the left in the chest. It's located between the two lungs, the right and the left lung. This is your diaphragm, one of our breathing muscle. That's your liver. This is your stomach, and this is your digestive system. Your kidneys are behind. Let's use a different model to look at the different parts of the heart. Here's the model of the heart. The heart is surrounded by a membrane called the pericardium, also called the pericardial sac. The pericardial sac encloses and protects the heart. It has layers. It has the visceral layer and the parietal layer. And the space between the layers is called the pericardial space, which contains a fluid, which is called the pericardial fluid. The fluid helps to reduce friction between the layers when the heart expands during a heartbeat. A build-up of fluid between the two layers inside the pericardial sac can put pressure on the heart, and it's referred to as pericardial effusion. An inflammation of the pericardium, the sac around the heart, is called pericarditis. The role of the heart is to beat, to pump blood. A healthy adult has a heart rate of between 60 to 100 beats a minute. That's about 100,000 beats in a day. It's more than 3 billion beats in a lifetime. Your heart works really hard. It pumps about 5 liters of a volume of blood around the body and brings it back in about a minute and covers about 5 meters journey. It is a miracle. The heart is small. It's the size of a fist, and it weighs about 300 grams. It's a pump. It has 2 pumps. So the heart has 4 chambers. It has 2 atria and 2 ventricles. So the 2 atria are collecting chambers. Blood enters through the atria. And the 2 ventricles are pumping chambers. Blood exits through the two ventricles. So the ventricles push out the blood. So on the right side, you have the right atrium and left ventricle. On the left side, you have the left atrium and the left ventricle. Let's see what the heart looks like inside. So you have the right atrium and the right ventricle, the left atrium and the left ventricle. So you also have 4 valves, the white bits that you see here. So the valves, they open and close to allow blood to move from one area to another area. Blood needs to move in one direction. So the valves, they act like guarding doors to prevent the blood from flowing backwards. So they ensure that blood flows in one direction. And when the valves are not functioning properly, they might need a replacement or a repair. So you have between the right atrium and the right ventricle, you have the tricuspid. It has 3 cusps. And then between the left atrium and the left ventricle, you have the mitral valve, which has 2 cusps. And then between your right ventricle and the pulmonary artery, you have your pulmonary valve. And then here, between the left ventricle and the aorta, you have the aortic valve in there. So you have 4 valves that ensure that blood flows in one direction and prevent regurgitation. That means blood flowing backwards. Now let's look at blood circulation inside the heart. The heart is a double pump with 2 circulation, the pulmonary circulation and the systemic circulation. The right side of the heart is the pulmonary circulation, which sends the oxygenated blood without oxygen, to the lungs to get oxygen from the right side of the heart. The pulmonary artery, this artery here, carries the oxygenated blood from the right ventricle to the lungs via the pulmonary valve. It's the only artery that carries the oxygenated blood. Remember, arteries carry oxygenated blood away from the heart. The pulmonary artery, this artery, is the only artery that carries the oxygenated blood. In the lungs, gas exchange takes place. Blood gets oxygen and becomes oxygenated. It then comes back to the left side of the heart, to the left atrium. In here, it comes back through the pulmonary veins. The pulmonary veins, we have 4 pulmonary veins, 2 from each lung. The pulmonary veins are the only veins that carry oxygenated blood because they are coming from the lungs. Normally, veins bring back the oxygenated blood to the heart. From the left atrium, blood then passes into the left ventricle via the mitral valve. Then from the left ventricle, it is then pumped through the aortic valve. It goes through the systemic circulation, through the aorta. This is the big artery, the aorta. So the oxygenated blood, when it gets into the left ventricle, it is pumped into the systemic circulation, and then it goes all around the body to every tissue and organ. The myocardium, the heart muscle, this part here, is thicker in the left ventricle than in the right ventricle, so that blood can be pumped into the systemic circulation with enough force. The systemic circulation is under higher pressure than the pulmonary circulation, and only 15% of the total blood volume ejected into the systemic circulation goes to the brain. The biggest amount, 20%, goes to the kidneys. The oxygenated blood from around the body then comes back to the right side of the heart, into the right atrium. Blood coming from all parts of your body, venous blood, collects into this big vein called vena cava. You have the superior vena cava and the inferior vena cava. The superior one collects all the blood coming from head, chest, shoulder, and the inferior vena cava collecting blood coming from legs, pelvis, abdomen. It all comes down the vena cava into the right atrium. From the right atrium, the deoxygenated blood then passes into the right ventricle through the tricuspid valve. Then from the right ventricle, it's then pushed into the pulmonary circulation to the lungs through the pulmonary artery via the pulmonary valve. So this is the aorta, and that's the aortic arc. It's a big artery. So the systemic circulation comes through the aorta and takes the blood throughout the rest of the body. You have, it's branching here. You have the common carotid artery, and all these arteries would take blood to the top parts of your body. The aorta comes down. You have the descending aorta. You have the abdominal aorta. They will take blood to the part at the bottom of the body. It's a very big artery. So that's a complete circulation of the blood within the heart. So blood coming back from all the parts of your body comes back down the vena cava, right atrium, right ventricle, through the pulmonary artery. It goes into your lungs, get oxygenated, comes back through your pulmonary veins, through the mitral valve, into the left atrium, then left ventricle. Then it's pushed into the systemic circulation, goes to every tissue and organs, and they get oxygen, and then the blood comes back. But it happens simultaneously. So blood comes into the two atria, and it's pushed through the tricuspid valve and the mitral valve, and then it goes into the ventricles, and the ventricles then push it out. From the left ventricle, blood goes into the systemic circulation, and then from the right ventricle, blood goes into the pulmonary circulation. In my next video, I'm going to be looking at heart conditions and treatments. Thank you for watching, and please remember to subscribe.